All right, another one. Treadwell DPT, anatomy breakdown, muscle by muscle. Today we're getting as deep as we can get. The core of the core. We're talking about the Quadratus Lumborum. Very, very deep muscle, underappreciated, very clinician coded. The gym guys aren't too concerned with the QL at all, but it's interesting. It's definitely one of the most overworked and undertrained structures in that deep core. So let's break it down and see what we got. The Quadratus Lumborum is often considered a back muscle, but it's technically our deepest abdominal muscle. It sits in that posterior abdominal wall, just lateral to the spine, and plays a major role in frontal plane stability and lumbopelvic rhythm. Our Quadratus Lumborum originates on that posterior half of the iliac crest, as well as on that iliolumbar ligament. It'll insert onto the 12th rib and the transverse processes of L1 through L4. So just to reiterate, our Quadratus Lumborum originates on the posterior portion of that iliac crest and inserts onto the inferior border of rib 12, as well as the transverse processes of vertebrae L1 through L4. The Quadratus Lumborum plays a crucial role in both movement and stability of the lumbar spine. If one side activates, it contributes to ipsilateral or same side bending, allowing that torso to flex laterally. When both sides activate, it assists in lumbar extension, helping maintain upright posture and resist that forward flexion. The Quadratus Lumborum also stabilizes the 12th rib during restoration, so acting as sort of an anchor point during that diaphragmatic breathing. Functionally, it's a key player in frontal plane stability, especially during gait. It's a very important ambulatory muscle. A lot of activity during single lib stands, as well as during the asymmetrical loading tasks like carrying a suitcase or a dumbbell in one hand. Whether you're walking, lifting, or just trying to stay upright under a load, the Quadratus Lumborum is working hard to prevent you from collapsing sideways. It will often pick up the slack when other stabilizers like the obliques or gluteus medius aren't quite doing their job. So yeah, if you've ever done like a suitcase carry or single leg deadlift, you at least owe partial thanks to your Quadratus Lumborum for keeping you straight up. Not a super clean innervation here, but the Quadratus Lumborum is innervated by the ventral rami of nerves T12 through L4. So it makes it neurologically connected to both core stability and lower limb control. Ventral rami just meaning anterior branch. We can look here to see the separation from dorsal to ventral. For instance, at L1, we've got our ventral or anterior ramus heading out front. We've got our dorsal or posterior ramus heading out back. So cool to visualize that difference. Just to reiterate, our Quadratus Lumborum is innervated by the ventral rami of nerves T12 through L4. Quadratus Lumborum is innervated by the ventral rami of nerves T12 through L4. Clinically, the Quadratus Lumborum is often a primary culprit in chronic low back pain and functional imbalance patients. especially when combined with those pelvic abnormalities or gait deviations. It's fairly common for a patient to present with low back pain, lateral pelvic tilt, or gait asymmetries caused by a tense, tight, or fatigued quadratus lumborum. You'll often see quadratus lumborum compensation in people with oblique or core imbalances, people with that functional hip drop or Trendelenburg gait caused by that glute med weakness, or potentially even in people with some of those other gait abnormalities such as poor hip flexion or foot drive that'll affect foot clearance. We've got a 2024 study that investigated the effects of combining quadratus lumborum muscle energy techniques with glute med strengthening in patients with that SI joint dysfunction. The results showed significantly greater improvements in pain, disability, strength, and quality of life compared to traditional exercise alone. So it's very beneficial to target that QL through a variety of techniques, as well as work those hip abductors like the gluteus medius for our patients with lower back pain, SI joint pain, and those hip pain symptoms. Manual release, target stretching, and core training, especially for that frontal plane control, are really important for quadratus lumborum rehab. I'm also pretty big on dry needling that quadratus lumborum as well, but it's not the easiest technique by any means. But consider this. If you've ever got a patient that points just above their iliac crest and says it hurts right here, more often than not, that's an indication that they're dealing with quadratus lumborum pathology. So definitely keep all that in mind when you evaluate a patient with low back pain, especially if they report that lateral stiffness, they point to that area above their iliac crest, they've got a little hip height, or they've got some sort of gait imbalance. Check that quadratus lumborum tone and check that quadratus lumborum mobility. If you're ignoring the quadratus lumborum with these type of patients or clients, you're missing an essential piece of long-term core and trunk control. So that's our quadratus lumborum. PT muscle for sure. Definitely should be considered with all of your lower back and hip pain patients. Quiet, stabilizing, and often overworked and a little angry. As always, drop a like, leave a comment, and hit that subscribe button to keep up with the anatomy breakdown series. Much more in store, even more to come. Stay tuned, stay locked. Treadwell DBT. I'll catch you next time.